Once in every 34 seconds. That's how often someone's diagnosed with heart disease in this country. And the American Heart Association says it's affecting African American communities at an alarming rate.
For Ron Walker, grilling, baking, and broiling is part of the everyday cooking routine.
Usually if you're in that old mindset of frying things, that's what you're going to go back to. So you think about what foods you want to cook, how you want to cook it, and follow through and get it done.
Walker doesn't have much choice. Heart disease hit him hard. It's led to 2 heart transplants, and he says growing up with traditional African American cooking didn't help. That usually meant foods high in sodium and often fried.
That's what the African American community needs to accept, and accept as a whole, that some of the foods, byproducts that they're eating is not healthy for them.
Doctors like Rahul Agarwal agree heart disease is a killer.
Heart disease is absolutely an epidemic.
Dr. Agarwal says there is a general lack of vitamin D within the African American population, but medical experts are still searching for the heart disease link.
We're providing the same science, the same medication, yet sometimes, in many cases, we're not seeing the same results. And so we're always asking ourselves what gives.
Walker now cooks with salt substitutes and doesn't fry foods. Doctors say start these practices early on.
Really instilling those habits in children, because it's a lot harder when you have a 55-year-old gentleman who's been living a certain way of life and then suddenly to have to upend all of that.
But if you eat better, you'll live better, says Walker.
Physically, if you treat your heart like you would treat your family members, then your heart will treat you right.
In turn, living a heart-healthy life. Mike Trim, WPTV News Channel 5.